using technology to keep track of medications. Welcome to another Techstination interview. I'm Fred Fishkin. Joining us is Michal Levin, VP of Product at Hero Health. Thank you for joining us, Michal.
Thank you for having me.
Well, give us some background, first of all, of what Hero is about.
Great question. So Hero is basically a fully connected medication management solution that is bringing together a smart pill dispenser, as you can see behind me. It's already kind of like here, as well as a connected app and an integrated prescription refill and home delivery service. And this project launched in 2018 and dispensed over 30 million pills to date, with the big goal of helping people address medication management.
Tell us more about the need for this type of device. There are some real problems out there that you're aiming to solve.
Yeah, that's a great point. And actually it goes back to how Hero was created in the first place. So that's an interesting story that I think worth sharing. The creation of Hero actually started by Cal, who is Hero's CEO. And that started from his own personal experience with his mom. So she's a primary care physician who went through a bypass surgery in 2013. And after that, she had to manage a pretty complex medication regimen of about 16 medications a day. And the daily challenge actually proved out to be highly significant. And it was interesting because, Cal and his family were quite surprised. She's a doctor, so if anyone should master the meds, it's her. But as they learned, proper management of medication is a highly complicated process, physically, logistically, and emotionally. And his mom was unfortunately had to get readmitted to the hospital twice due to not taking her medication as prescribed. So at that point, this was kind of like, a point in time, this aha moment for Kyle, kind of like realizing, hey, we have a real problem here. And if you zoom out and you look at the data, at a nation scale and also globally, there is, a big problem. So 50% of patients in the US don't take their medication as prescribed. And keep in mind that about 1 in 2 adults in the US have at least one chronic condition. We're talking about 145 million people. And this number translates to, real effect. So we see 125,000 preventable deaths in the US every year and 30% preventable hospital readmissions. And this also adds up to $300 billion in healthcare costs every year. So this is a real issue that has impact both on people's lives as well as the healthcare system as a whole.
So step us through how Hero is used from the consumer perspective.
Sure. So Hero was designed particularly, for people who have complex medication management regimens and complex, just like chronic conditions. So the way that it is built, as I mentioned, there are three components. So we have the smart device that you see behind me. We have a connected app, and we actually have an app both for the member themselves as well as their caregiver if they have one. And we also have an integrated service to help with the medication refill and at-home delivery. So Hero is a monthly membership, and once you order one, you get this device delivered to your home. There is a simple setup process, basically to just kind of like define who is going to be using it, which medications are you going to use and when, so what is the schedule and what is your experience preferences. And once you get through with that, it's about a 15 minutes process. The device is ready to go. And it is connected, as I mentioned, to the app. What the app provides is a couple of things. So first, when it's time to take the medication, the device, as you can see, it has like a visual feedback as well as audible. So when the time comes to take the medication, it chimes as well as provide visual feedback. In case a medication is missed, we actually send a reminder both to the member and their caregiver, just to remind them. Also, through the app, you can actually track in real time the medication adherence progress to just make sure people keep on track. You can also change the settings of the system remotely, so you don't have to be by the device. And if you think about different context of care, for some members, their caregiver is remote, they can't be there every hour of the day. So that helps in really caring for a loved one remotely by using this fully connected system.
So how many medications can be put in it at a time, and how big of a supply?
Yeah, that's a great question and a very important one. Because as we see from our members and from research, one of the biggest pain points with medication management is that a lot of people rely on plastic pill boxes, weekly containers that they need to spend hours every week replacing the medication, filling it in, and they usually are not sufficient. So you need to buy a couple of those, and it's just a really, really burdening process. With Hero, you actually have within the device, you can store up to 10 different pills, any size, any shape, and up to 90 days supply. So basically, you fill it out once and you can go with your medication for up to 3 months. So that really simplifies the process.
Terrific. And this is, I guess, designed primarily for people who are taking medications on a regular basis, once a day, twice a day, whatever it happens to be. But what about situations where you become ill and you have a prescription that's for the next 10 days or so? Can those be added easily by the user?
Yeah, that's a great question. And I think it's also applicable to people who take a lot of medications regularly. Oftentimes, their doctor wants to experiment with different prescriptions for limited time periods to see how it impacts their health and what are the side effects. So I think this is a very important question. I would start by saying that Hero is available and open to every member who takes 4+ medications a day. With that said, the system was designed particularly with the most vulnerable populations in mind. And by that, I refer to the 5% super users, which is a medical term to the people with the most complex medical needs, which really account for the 50% of healthcare costs. So with these people in mind and their complex needs, this is how we design the system. So you can, you have a connected app, and if you need to change your medication regimen, whether you need to change the schedule, you need to remove a medication and add a new one, all these things can be easily done via the app.
For the super seniors, if we want to call them that, the truly elderly people who are maybe 80 or up, they would need help, I assume, in setting this up, as they might in just filling out or putting pills in a pill box, right?
Right. Yeah. And that's a really good point. What we see from our members, just kind of like, we talk regularly with our members and we look at our data, but what we see that, people that are more on the senior side, they usually have a caregiver that helps them through their health journey in general, taking them to doctor's appointment and, making sure that everything is okay with them on a regular basis. So also with Hero, a caregiver usually helps set up the machine and the ecosystem as a whole. But outside of that, what we repeatedly hear from our members is just how much independence this solution provides. Because at the end of the day, once the system is set up, it really takes one button press to just dispense the medication and take it. So it's not like you need to interact with it regularly, go through menus. You don't need to do all of that. Once the system is set up, your loved one is going to get alerted when the time comes to take the medication. It lights up, it shows a message on the screen. All they need to do is press this big button that you see here, behind me, and the device automatically sorts and dispenses the medication as was set up in terms of the schedule and the pills included. So it's really easy. And again, we hear a lot from our customers and our members, just like how much of a lifesaver this system has been in allowing people to stay at home for longer, in being able to maintain independent lifestyle and just having a better quality of life.
Does it retain what's programmed into it in the event of a power outage, that kind of thing?
So when there is a power outage, we actually provide our members with an emergency key. So if a power outage takes place, they can just open the drawer and they can take their medications out. So that's, the machine does kind of like pause working when there is a power loss, but once the power is regained, everything is restored and everything is already set up.
So it doesn't lose what's been programmed into it?
No, it's all stored on the cloud. So that's part of, the advantage of having a connected system. I would also add that, because this is a connected system, it is connected to Wi-Fi. And in the case that the Wi-Fi get disconnected, the device continues to work regularly. So we also store the schedule as entered also on device for these cases, so it can operate in an offline mode. So it doesn't stop working if your Wi-Fi is disconnected.
Tell us about pricing and availability, how people can get this and what it costs.
Sure. So we have a monthly membership. This is how Hero operates. So you can order the system through our website, herohealth.com, $29.99 per month. We also have a one-time initiation fee that is $99. But from that point on, it's just like a monthly membership of $29.99. And as I mentioned, it covers all the different components of the system, which includes the smart dispenser, the fully connected app, both for the member and the caregiver, that is being updated in an ongoing way with new features and new capabilities. Also, as I mentioned, integrated service for refill and home delivery of your prescriptions, and also 24/7 customer support for any questions or any needs.
So roughly $1 a day for that kind of peace of mind.
Yeah, that's exactly it. That's a great way to put it.
Where do you want to take this from here? You mentioned other capabilities and updating and such.
Yeah, that's a great question. As kind of like,
you can't tell me.
yeah. I think I can just give, I would love to come back and talk more about, where we take our product and our future. But I can just say, when we look at at people's needs and we see and we look at the journey that they are going through, we see a lot of potential for growth, both in continuing to support our members across the continuum of care, because really Hero is committed to solving medication adherence in a 360 degrees manner, as well as really understanding medication taking in the broader context of their health condition. So as I mentioned, I would love to come back and discuss further some of the things that we are building to support that more broadly. But there's definitely a promising way ahead.
Terrific. For more information or to purchase, you can go to herohealth.com. Michal Levin, thank you so much for taking the time with us.
Thank you, Fred. It's been a pleasure.
Now this. It takes a lot of listening to build a better radio, and that's just what the folks at C. Crane have done. Bob Crane and his crew, nestled among the rivers and tallest trees in the world in Fortuna, California, have made a habit of listening to their customers. And that's just what they've done in building the CC Skywave SSB, the Swiss Army knife of portable radios. For everyday listening to AM or FM in the yard or patio or on the nightstand without having to drain a mobile phone battery, it's a great companion. But it is also a companion equipped for NOAA weather information and alerts that can be life-saving. You can listen to FEMA and Coast Guard transmissions too. Beyond all of that, you can tune into shortwave signals from around the world. It's compact, easy to take with you, and built to last. The CC Skywave SSB. Click on the link at Techstination.com.